Hello, everybody. Good evening, and once again, welcome to yet another very exciting episode of ELECTICA. So, this is episode number 20 of 2020. So, today I have someone very, very special, and he is very popular, by the way, in our dental fraternity. But before calling him in, I just want to tell few words about our guest today. So today I have Dr. N. Aravindha Babu with me here inside the studio in Eclectica. So those who of you don't know him, I'm pretty sure that many of you know, but I think many people who will be watching us from different parts of the world. So let me just give a brief introduction because Sir has so many accolades that it's really difficult to sum it up in a small time. To highlight, Sir is the professor on the Department of Oral and Maxillofacial Pathology, Sree Balaji Dental College and Hospital in Chennai. And before I highlight the most important aspects, I think Sir is here and I will just call him in and then I will go to his introduction. Welcome, Sir, and thank you for accepting my invite to Eclectica. So I was just trying to introduce you, and I was just trying to say the fantastic work you have been doing. So to my audience, we have Dr. Aravindha Babu with us right now. And today we will be talking on oral health care research as a career prospect. So little bit about Sir, that Sir is the first person and he is the authored the first dental awareness book in braille and sign language CD for hearing impaired, and this is first of its kind in the world. So that's amazing. And I already told that Sir is a professor in the Department of Oral Pathology in Sree Balaji Dental College and Hospital, Chennai. Other than that, Sir is also an Assistant Director, Center for Oral Cancer Prevention Awareness and Research, Bharath University. He's the co-editor, Journal of Oral and Maxillofacial Pathology, Associate Editor, Indian Journal of Multidisciplinary Dentistry, and he has authored almost more than 37 textbooks, and he has published more than 160, and I think that number has increased right now, research papers. Apart from that, Sir also is the director of Aravind Multispeciality Dental Care Center, Adambakkam, Chennai. So welcome, Sir, once again, and it's amazing to have you here. And I think through our discussion, particularly the young stars who are quite in a position of anxiety and dilemma at this point of time, I think they'll get a very good insight from your experience. So, Sir, first you tell me that how are you and how you have been handling this pandemic situation. I think that is one question nowadays we ask each other.
I'm fine, madam. Hope you are all doing good.
Yes, sir. So, sir, let's start our conversation today.
Yes. We have lots of cases in Chennai. No, it has started reducing.
Yeah, I think recently we also saw some there is a containment in Chennai, and I think that's a good sign that it's not increasing more. So I hope I'm audible clearly, sir, to you. Okay, so
yes.
Okay, sir. So I think, sir, being
yes, madam, academic, you're audible, madam.
Okay, being an academician for long now, and particularly when we talk in dentistry, I think oral pathology, among the 9 disciplines, oral pathology is one of the finest branches of dentistry that shows a direct pathway towards interdisciplinary research. But I think still in present day, the aspirants, particularly those who are aspiring students, I think they do not understand or do not find this subject interesting. So I think I would like to know your views regarding this. I think there is a lack of time.
Am I audible, madam?
Yes, sir.
Am I audible, madam? First of all.
Yes, Yes, sir.
Good evening,
You're
all.
on.
Yes, madam. Before starting as a oral pathologist, I just want to say a few sayings from William Osler. He's a renowned pathologist from Canada. From 17th century, he did lots of work in Canada. What he says, as is our pathology, so is our practice. As is our pathology, so is our practice. That's one of my favorite quote. As if my pathology, my practice would be better. Second, my favorite quote is, what the pathology thinks today, the physician deals tomorrow. What the pathology thinks today, the physicians will deal it tomorrow. I think as a pathologist, we know the diseases much more earlier than clinicians and those who are delivering treatment options. Basically, pathology is a science of medicine. I prefer to say that oral pathology should be the parent for all dental sciences. This is my point of view. And my point of view, what I finished my postgraduate somewhere around 2004, madam. I have a PG teaching experience of 16 plus years, so 2 decades nearly, being a student and being a practitioner and being a researcher, so-called researcher, whatever it may be. So we are under a thought of guidance that dentistry is a branch of subject which deals with tooth extractions, fillings, implants, dentures. We never thought we are much more capable than or par equivalent to medical fraternity or more than medical fraternity. Now I feel that I'm happy to be a dentist, but I'm also proud to say I'm an oral pathologist. But to be for writer side, I joined oral pathology by pressure, not by passion. I never had passion to join in oral pathology department because of pressure and some sort of family situation. I couldn't able to offer more money for clinical branches. Now I feel very very proud that I have chosen a proper branch and have started doing what I have decided. For your question, there is no proper guidance for students. I think people like you and people like me have to take this concept to each and every dentist that you are much more than what you think inside. We have to get something, we have to give a knock to each and every mind and each and every brain that you don't sit inside a shell. You have a very, very big galaxy. I used to say it's a very big galaxies you have and a very big array you have. But don't think that you are restricted to oral cavity or you are restricted to 32 teeth permanent or 20 deciduous teeth. You are far superior than other branches comparatively. Technically, research has been carried out in very very meager way in dentistry. Totally, I feel in India, research activities are not that much. That much in higher rate compared to other populations. Probably maybe because of lack of funding agencies. I feel funding agency, let it be secondary. Lack of motivation to do research and lack of knowledge in which area we are supposed to do research, what research we are supposed to do. People think that research is something which we have to do it in a very big room with a long beer and from morning to night, midnight, every day morning, every day, every night, and 365 days we have to sit inside the lab, not able to see family, not able to see kids. That's nothing. Research is something which is very close to you, which is inside you, which is near you. There are two researches: clinical research and molecular research. Clinical research, as a practitioner, each and every patient is your research material, right? I don't call a patient as material. Research things we can take. As a sort of material science, you can do lots of research. As a dentist, as a oral pathologist, you have lots and lots of research scopes like molecular biology, genetics, and so many things. Probably in your next question, I'll deal what exactly we can do as a pathologist in research and all. Yes, ma'am. Next question.
I think that was fantastically said, sir, and I think you have spoken my mind. And I totally agree with whatever you are saying. And yes, my next question is almost similar to your line of thought. Is that as you rightly said, that with research, whenever we use this terminology research, there is kind of a bulb on in people, and this think there is something which is not cup of tea of everybody. So I think it's time that we have to break that wrong notion. So, sir, as we all know, that research is an important agenda in any subject matter or any stream that matter. So, when it comes to dental sciences, I'm just taking the trail of your words, as you rightly said. Even I feel, particularly in India, the research in dental sciences, that essence of research is not well understood. So, as that you agree with this, so can you just highlight that? Why do you think that research hasn't been, particularly in oral health care I'm talking about today? So why is a hat why what would be those reasons, according to you, that the essence of research in dental fraternity has not been reaching the way it should have been? Because if we see in the other part of the world, I think most of the revolutionary researches, everywhere we find a dentist, and particularly the field that I am interested into, like saliva. I think I don't have to tell, I can just tell many names when it comes to salivary research, and all these revolutionary people are dentists. So I think I will like to hear more from you rather than me speaking today. Yes, sir.
Madam, can you repeat the hint of the question again?
Yes, sir. I was asking you that, like as you rightly said, that the research in dental sciences in India, it has not, the dental fraternity particularly hasn't seen the essence of research that way as they would have been. So I was just trying to understand from you, what is, according to you, would be the most probable reasons. Well, you have enumerated few of them, but what, according to you, would be the most important reasons why this is happening, and maybe a little highlight how we can bring some changes in this area?
Yes, yes, madam. Actually, we are doing research without our knowledge itself. Yeah, all the PGs will do thesis, do dissertations. We are thinking
Correct.
there's a part of our study. We never thought that this is a contribution for our society. We should have two things.
Absolutely.
We have to contribute. See, we live because of patients. We learn because of patients. So something we have to contribute to society. So that thing should be there in each and everybody's mind, that so whatever work you do, even a small journal club or a small library decision, or maybe your main thesis, don't do it for an academic sake or completion sake or sake to get degree. Probably everybody is doing sincerely, but they don't know whether they're doing sincerely. Till
Yes.
today, I have seen so many dissertations. I have corrected so many dissertations with the last paragraph saying that furthermore studies has to be carried out to conclude, or furthermore studies has to be carried out, or some more studies has to be carried in other population. What is getting under? So what I say is, whenever you start your research or whenever you start your thesis, I think thesis for postgraduate student and for undergraduate student, you have more opportunities nowadays. Like, for example, you have an Indian Academic of Genetics, or so many dental councils, so many other associations where they conduct many conferences. We can go and present our original research. So you can start doing short studies for undergraduates with guidance with your staff members. Probably you can come out with new topics. Probably in my other questions later, I'll tell you, give you some sort of ideas what all you can able to take. So now onwards, I request all PGs and all grades we are doing properly, but we design the study in such a way that to get accurate results. Accuracy is very important, because your research and your publication, it's going to be a key article for some other study. You don't give some sort of wrong proceedings. So I feel you better associate with some sort of epidemiologist or some sort of statisticians to get the sample size, like the sample sizing correctly, or to get the proper amount of research work where it has been carried out, get an idea. You don't keep on doing some pilot studies, then you leave, then at the end you don't get time for pages, then somehow we reduce the patients and we finish the thesis and go. We are doing research, do it sincerely. That sincere effort of a small, probably if I do something with 10 cases of lichen planus, I should ask to myself that whatever the conclusion, whatever the thing I am giving, is it useful for any practitioner? Is it useful for any postgraduate? Is my conclusion of this, if every PG started thinking, is my conclusion of the study is going to do any impact over society? If that point you get answer, everything's good. I think by this time you could have had lots and lots of works, and our total idea towards research could have been grown much more in a bigger way. We are not exposing ourselves. We think that it is routine, but research is something bigger, research is something higher. I'm not a researcher, so don't think researcher, saying the researcher is the thing that you should be in a supreme position. I can see so many youngsters like UGs you are supporting. I see so many of your YouTube channels videos. Last time also some saliva and cardiac markers, some studies I have seen. So many undergraduates. I think they have to come out from the shell that I have to do something that is going to help the society. That concept, if it comes now, you think somewhere around thousands of PGs coming with thousands of new researchers every year. That should be useful for the society. As a pathologist, we can do both clinical researches, inpatient, or molecular researches. Whereas this kind of research is restricted to other branch of dentistry like prosthodontics or orthodontics or endodontics or something. They can do, but their research area will be bit restricted. We have very vast areas. We have body fluids, we have tissues, we have genetic, we have molecular biology, we have patient study we can do, we have clinical trials we can do drug trials. So I think we are master in research. Probably we can, from this time, from now onwards, we just plan our research properly and execute whatever we do in a proper way and come out with a proper paper, scientific papers, and present it in some sort of conferences. Make your research to be prominent, to be present to others. It should be published, or it should be reached to maximum population throughout the globe. Then only you get a sort of recognition. It's from my side, madam. I don't say nobody is trying for research. They're trying for research, but they don't know they're trying for research from their side itself.
Exactly. I think I agree totally with you. And rightly, as you said, sir, that is what, again, the message goes out from my side always also, that whenever, particularly as a clinician, when we are thinking, like as you say, that we can do two types of research, so we can always blend. And our when we are trying to do something we should have that problem solving attitude inside our mind. And as you rightly say, that if each postgraduate student, each undergraduate student, particularly in dentistry, and they come up with small new ideas, and not only that, we can think of a big project with a bigger goal, and that project can be subdivided into small mini projects that each student can do. I mean, planning is the main key, as you rightly said. And yes, I totally agree with you. So I think awareness is one factor that I can always say. And as you said, very important thing that you mentioned is the mindset. I think that is where we need to really think on. And particularly when people are in the position of faculty, they hold more responsibility, because I think people, they can change the students' mindset. So I think that is the area which is very, very important, as you highlighted very rightly. So sir, another question, since we're talking about oral healthcare research as a career option, what would be the prospects today? Is that is what we're trying to highlight through our discussion. So, sir, my question is that, in perspective of India, I would like to know your insight. Suppose, say, a student wants to take up research as a, particularly oral healthcare research as a career in India. So I know that you are an avid academic researcher. So what would be your message or your guidance to those people who are really interested? And I have seen, sir, a lot of interest since I have been closely working with undergraduates, as you mentioned rightly. So I have seen that spark is there. They are not, it's just that they are not aware, but once they start delving in, they come up with their own energy, that I have experienced. So, sir, can you please guide us in a way, so that if a student is really interested to take up research as a career pathway. So, what would be the step-by-step procedure that they should follow according to you from your experience?
Yes, madam. This is a very good question. I didn't expect this from you. But the thing is, each and every dentist should make it very clear that uh, once if you go into research, you won't get job security. See, everybody are thinking in a way of job security, job guarantee. I want to do my practice. I want to earn money, or I want. If I go into research, probably my research outcome may be good, or I may fail in my research, or that kind of dilemma is still there. They're thinking that after dentist, put up a clinic, or after post graduation, join into a college. So they think it's a sort of a job guarantee for them. So they get a lump of money, and with that we can manage the family, all these things. So they have to come out bit. See, research will fetch you infinite amount of money. Nobody knows that. One of your research or one of your patent, if you come out with that, you may be a billionaire, you may be a millionaire. That thing you should take a calculative risk. And nowadays research has been very much simplified. You can drive in both boats. Evening you can go for a practice, morning you can go for research. So this you keep it in mind that nobody is restricting you or restricting the researchers to stop from doing their day-to-day practices. Either do your evening practice, go for consultation, go for teaching, whatever things you want to do, that's a separate earning. Research, whatever comes, I just request to all postgraduates or all undergraduates, whatever comes to you in your mind, I may call it. It may be so many things it comes in my mind. It may be a stupid thing also, but I write it in my paper. Write it in a paper. Keep on writing. Make a note whatever it comes in your mind. So whenever you get opportunity, you discuss your concept with like-minded people. So they will tell you whether your concept is right or wrong. There's nothing wrong with that. We all do mistakes. Without doing mistakes, we can't learn anything. Without failure, nobody has succeeded. Everything, including topmost Nobel Prize winner, also whoever it may be, without any failure stories, there is no success story in any textbooks or anything. So don't hesitate to fail. If you hesitate to fail, you have to face a big failure. If you don't hesitate to fail, you can see success in your next step. I'm not a motivational speaker, but though I see that, I say that if you hesitate to fail, if you hesitate to do something, what will happen? What will happen? If not, what will happen to me? If not, what will happen to me? Means you have to take some sort of calculated risk. That is not a risk. That's a sort of a very big planned. You are promoting yourself as a researcher. Okay.
Right.
Once if you come into a full-time researchers, it is up to you to close your practice or not. So obviously, those
Exactly.
who taste research, no, they won't come to practice. Those who
Yes.
those who taste practice, they can come to research
Yeah.
because now I have lots of thoughts, materials. I do research, I do practice, so I can implement. For example, if some drug is not healing a disease of my patient, I have to think what I have to do. So there my concept starts as a practitioner. So every practitioner is a researcher inside. So any doubts it arises. For example, this drug is curing the disease in Singapore. Why not this drug is curing the disease in subcontinent of India? What happens if you do its molecular research? So you take a biopsy, take a cell, take the gene, take the DNA pattern, RNA pattern. There we can find research and all. So as a practitioner itself, you can get lots and lots of ideas, lots and lots of sparks inside you. It may be very frankly, I may be a stupid example if I say, when I'm doing my undergraduate, I was thinking about, I used to do so many dentures, prosthetic dentures, upper dentures. I fight with lower denture. Patients won't get satisfied with lower denture. It will come out all this thing, that thing, and that. So one day I was sitting at my room and thinking that why can't I fix? I don't have any idea about anything apart from studies that time. I did my UG at Bangalore. I was thinking why can't I put four magnets in lower ridge and four magnets in my denture? It will go and fix. I was thinking that time I don't know anything about implant. I don't know
Amazing.
anything
Yeah.
about implant. I can switch. I can under the mucosa. I put a small magnet, biocompatible magnet. stitch it. Then I'll put my denture with magnet. Because I'm frustrated with patient, I don't know what to do to the patient. Every time, no, they'll come, no, when I see patient itself, no, my heart rate will increase and my BP will increase. They'll come, sir,
Right.
it starts fitting, it is coming out, all this and that thing and that. So that time, it may be stupid. That later I realized that something somewhere in the world it is going on in 1998 or 2000, that implant processes. So
Correct.
my idea is that I need something for retention. Why can't let it be a magnet in under the mucosa? I'm putting a tensor with magnet over there. Then suddenly next day, again I got a doubt. If I put magnet inside the tissue, there will be blood circulation. The iron content inside the hemoglobin, will it affect the hemoglobin? Whether the iron content will be circulation will be goes wrong. I went and spoke to my prosthetist. He told, I think you got less work at home. You started thinking more. You write more assignments. You write more tension. So it may be a stupid or whatever it may be. So you just start thinking, and start developing some ideas. One day it will be possible. It is possible. It will be possible. That is in your hand. If I could have initiated that, probably there could have been some sort of system I can develop on my own. Now I could
Right.
have been a proprietor of the company.
Correct.
I could have
Correct,
been a
sir.
proprietor of the company. It's a small idea, magnet denture. That's it. Upper, I don't have any problem. Lower denture, magnet denture, magnet denture, magnet denture.
Fantastic.
So this is the
Yes.
concept. So once if you come into research, you are doing two things. You are earning a lot, then you are serving the society. Both things. So the thing is, you just don't neglect any of your what I don't want to say the stupid ideas. Any small ideas, you just make a note and discuss with your friends or colleagues, and you can improve your further ideas. Yes, ma'am.
Sir, I think you have enlightened us so much with your experiences, and I totally agree what you say. And I don't think anything, any idea is stupid, because anything which we see today, because right now, like me and you, we are talking, or nowadays we talk in video call. We are, I mean, we are chatting. In Facebook, we are seeing each other, and we are seeing photos. Who has thought? At least in my college days, I never knew that something 10 years or 15 years after, in the future, something like this will be there, where even I'm sitting in some city, or my mom is in another remote area, and we can talk, we can see each other. I mean, that's something that has happened. So I think any ideas, and I think you have given a very, very simple but very important information or message, that is, any idea that comes to your mind, which you don't have to judge it as a whether it is wrong or right, but write it down on a paper. I think this is a very important message from sir to all of us. It's not only about students, even for us. And as you rightly said, sir, the taste of research, that is fascinating. And I think we just have to work more on that side, and give plates of different tastes to people, so that they also taste, and this community grows very fast. And sir, I would just like to know your insights, that 10 years from now, because the world is changing very, very fast. So, as an oral pathologist, as a specialist in your area, uh, how do you see oral pathology as a entity, or a subject, or a specialty 10 years from now? So, I really like to know it from you.
Yes, madam. Yes, madam. I have a vision. It is possible vision only. I don't have any. If it's impossible, also it's possible only. If I don't try,
Right.
only it's impossible. If I try, it's possible only.
Yes.
So whatever I'm going to say, this is going to be the medicines, the treatment options in future. We all know about omics. So now we come out saliva. I think the salivanomics, it's going to be the diagnostic technique, because it's easily available, cost effective, less ethical issues doing the research. You're not harming the patient, you're not hurting the patient, and that is available in a maximum quantity with maximum amount of biomaterials in that. So I feel that the researchers are more towards salivary based researchers. I, I want to say that we are going into salivanomics. So under salivanomics, you have genomics. Okay, this when you study about DNA, then it's called as genomics. Then you have transgenomics. When you study about RNA, anything, it's transgenomics. Then you study about proteinomics, all proteins. Then you study about metabolomics. It's again metabolomics, all carbohydrate, proteins, amino acids, everything. Because our whole body's function is biochemical reactions. As a result of biochemical reactions only, all biochemical actions only, each and every part of your body is functioning. Each and every part of foreign bodies also function, bacteria, virus, and other things like that. So when you want to study about a structure, when you want to study about a cell, you should know a bit about the biochemistry. That's or what is biochemistry? Whatever I speak or whatever I think, whatever hormones, whatever disease comes, it's all biochemistry only. The biochemical studies can be done with saliva. That's going to be the future. Now we are discussing about lab on chip. Lab on chip. If you have to
Yes,
get a small chip, like we never
absolutely.
have a glucometer in our hand. We were every time we are going out and giving blood test and waiting for 1 day or 2 days, then 8 hours, 10 hours, they give report. Now here in house itself, you can do you have a glucometer, and within a few minutes, you know what is the glucose level. It may not be accurately, but it will be near to accurate level. Probably I can say you are confirmed with HbA1c or other levels for confirmed with diabetic. So this is the thing in research. These things and all heading towards precision medicine. Precision medicine. That is going to be the treatment options further. It's like it's a tailor-made treatment for each and everybody. You just
Right.
imagine. You can't wear a triple XL shirt for everybody. You have to have
Right, sir.
a medium, large, small, XL, and double XL and XL. So nowadays we don't have the option. We never thought about that. What I am selecting. You think it's something you are selecting on your own for your body. That we have to do. So we all know the story of Angelina Jolie. She had got breast cancer. She came out well with very good prognosis. That's because of genomics or metabolomics, whatever it may be. Precision medicines we call it as. This concept has been presented in WHO by US President Barack Obama somewhere in his tenure 2015 or 16, somewhere before Trump comes. So he had told that this is going to be precision medicine. It is going to be the treatment option. All the biochemicals, all the biochemical reactions from any part of our body can be secreted in our saliva. Saliva is a fluid which can be which can the saliva is a fluid which can be taken for testing the cardiological disease factors or enzymes from neurological disorders or enzymes from diabetics. I can check amylase, I can check lipase, I can check any sort of I can take a biofilm and I can study microorganisms, which is costly.
Correct.
I can take a smear and I can take n number of diseases, and I can do a study on tailor-made study on which drug is suitable for which patient. For example, see, I am not talking about dentistry. We are in a position to diagnose complete total body diagnosis. Even in oncology
Absolutely.
also, the oncological process will be same throughout body. Either from P53 or whatever gene expression, apoptosis, any escape, any endothelial growth factor or vascular endothelial growth factor, whatever it may be, it is same throughout our body only. So we can check each and everything, and we can do treatment inside cells. You just imagine, if we are going to, the days are not far away, we are going to do surgery inside cell. We are going to do surgery inside chromosomes. We are going to do
Correct.
surgery inside RNA. We are going to do surgery inside DNA. We are going to rearrange the protein sequences. We are going to rearrange that RNA components to correct the life. See, you just imagine if this is happened, there won't be any cancer at all. See, as a clinicians, you see cancer when the lesion comes only. As a
Absolutely.
researcher, I see cancer 2.5 years to 3 years before it clinically manifests. Minimum
Absolutely.
1.5 years. 1.5 years before I see the cancer, I know. After seeing, it has poor prognosis. Before
Correct.
seeing, before I see and convey to them, it has good prognosis. It has good prognosis. So these things like pharmacogenomics, this we are going to, I'm
Yeah.
going to we used to term it as pharmacogenomics. Probably when I get opportunities, I'll say more about metabolomics and pharmacogenomics. This is just an insight. What are the research things available
Can be
at
done.
present? 10 years after, the 10 years it will go very faster. It will go very
Yes.
faster. So including for hypertensive, so I can decide whether beta blockers, it will suit them, reduce hypertensive, or calcium channel blockers, it will reduce hypertensive. Now I'm giving one beta blocker, one calcium channel blocker, and some other drugs too, as a package of drugs. So now after my research, or after 10 years, I will select the drug and give it to patient. Otherwise, in other term, now I'll give a treatment plan A option. I'll wait for the result. If that is not proper, I'll give plan B. Then wait for a plan C. Now what I'm going to do, immediately when the patient comes, I will take the cell, I will take the biomaterials from the cell. I will just expose to plan A, plan B, and plan C. At few hours, I know whether the cells are sensitive for plan A or plan B or plan C. Directly, I will start plan C or plan B or plan A immediately. That's the thing. So apart from that, one thing, what I feel is, like what you say, we never had a WhatsApp call, we never had a video call, we never had Facebook to have see each other. And you're sitting from Calcutta, I'm sitting from Chennai, and we are talking in spite of heavy rain outside Chennai and whatever it may be. You have a wristband. Who thought that your wristband is going to calculate your heart rate? Who thought your
Absolutely.
wristband is going to calculate your calories of food, what you take? Your wristband is going to calculate your pulse rate, and wristband is going to calculate your SpO2 level, oxygen rate, how many steps you wrote. What connection between your wristband and inside your body? You ever thought? See, technical people are replacing medicine. Medicine people are not replacing technology. I think we have to come out. We have to come
We have
out.
to
I
come
think
out. Yes.
except dentists, everybody is keeping hand in our plate. Everybody's having it is high time we have to eat. We have a very big dish. We have not explored that kind of array of items before our table. So some days when
Absolutely.
you diagnose a small chip or something, you can incorporate that chip in your upper denture. You can incorporate that small chip in your fillings or in your implant. That will
True.
monitor your saliva. Okay. So by doing that thing, I can get an alarm before my patient gets heart attack 3 hours before. I can get an
Yes.
alarm the patient 6 hours before the patient will undergo a fits or seizures. I can get an alarm through my mobile that the patient will undergo for a breathing difficulty or some sort of diseases. So I can start immediately. I can call, take some nitroglycerin tablet, take some aspirin, do food, eat, or come to hospital. I am expecting this thing will happen after 10 years. This is not far away. As a dentist, you can control everything sitting in a small oral cavity. Everybody is telling that what do you know apart from oral cavity. So I can sit inside oral cavity and I can control whole body. I can control whole body. So
Absolutely.
nothing is impossible. Nothing is easy. See, this will happen. This will happen when watch is doing all the thing. Why can't I, as a doctor, I can come with a device which can be incorporated in filling or something. Maybe that may be helpful in forensic medicine or with all your data that can be utilized for disaster victim identification. That may be useful for any other forensic studies. Anything you can do. So all the molecular things like NMRs, nuclear magnetic resonance. It has
Yeah.
a lab inside NMR. We can't even imagine that sub-microscopic labs are there inside. We can utilize that. I think if I speak much, it's difficult to understand. I think you can understand in a better way what I'm about to convey. We will have another separate thing. I can explain whatever I told. It is possible. We can do a lot with saliva. We can do a lot with researchers. We can do a lot with the resource of knowledge. What we have is much more enough. What I think, as a dentist, as a practitioner, as a pathologist, I am talking this much means once if you full time enter into research, you talk infinite number of times more than yes, more than my knowledge. Then after sometimes, all the other practitioners will come to you. In what way
Right.
means They before putting implant, they will give a drop of saliva. You just say, they will ask you, what is the bone condition? Is there any osteoclastic activities happening? Whether my implant will be, if I put implant, it will get success rate or not. Then what is the reason for this much amount of bone resorption? My FPD is not staying, my PD is not staying. I can stop dental caries. I can take a saliva and
Yes.
give for pH analysis, give for microbial analysis, stop dental caries. We are talking about corona. We don't know how is the commonest disease in India is dental caries. Not
I
other, we
think
don't have vaccines
that's
also.
globally a very common disease, sir, like dental
Exactly.
caries, and really we don't talk about it.
Yes, that's a common thing. We talk about tuberculosis, we talk about AIDS. We have World AIDS Day. Today, I have to say that today is National Oral Cancer Day. November
Yeah,
6th,
yeah.
today is National Oral Cancer Day. Do you have any day for dental caries? We
I
don't have.
I also don't know about that.
We don't have. We have to create a day for dental caries. That's a common disease. It's all come in my mind. I don't know if it will happen or not. Probably the viewers whom hearing, they can represent and they can create a day for dental caries. That day we can create awareness to all the patients. Zero cavity, zero cavity, zero cavity, and zero periodontitis or zero gum issues. Everything we can do. We can get a healthy life and healthy body after 10 years. That's my point of view. Anything more? Madam?
Mm, Amazing, sir. And I think the insights that you gave, I think it has already brightened up our audience who are listening right now, who are with us. Also, we will be listening the recorded version of this live interview. And I think it was really amazing to know about your insights and the things, the pretty pretty important but very simple and important messages that I think I will just try to summarize, which we got from you. Is that first thing is that, as sir told this to my all my viewers, particularly who are young aspirants, that as sir told, no idea is stupid, just write it down on a paper, keep writing, and think in a way which is which, as a clinician or as a clinical researcher, just think in a problem solving mode, what problem I can solve. So I think that is what second thing which sir has told, which is very very important. And nothing is impossible. Absolutely, I agree with sir, nothing is impossible. And rightly, as sir told right now, that it's not only about thought process, we just have to come out of our shell, and before everybody else eats our things, we have to jump into the plate of knowledge and do quickly. We have to just adapt quickly. So I think that was amazing, sir. And sir, I think you have already energized people, but still, to conclude this conversation, I will just request you to give what would be your one message to the, particularly to the young aspirants, or particularly students who are just coming out, or who has passed in this pandemic situation, or who are going to complete one session of their career. So I think, because there is a whole lot of anxiety in that group of the population, so I think your insight or your message will be really important and very helpful for them.
This is such difficult, madam. I can speak for hours. If you just confuse me for one single point, means I feel to say that don't get panic or don't get worried about anything. Everything is possible, and don't get scared to discuss with your seniors or professors or HODs. We have, as a student, I still have that habit. What madam may think, what sir may think, if you go and ask the question. If you break that thing from your mind, we are there to help you. I am there to help you.
Yes.
Madam is there to help you. There are so many people with like-minded people are there to help you. We will be with you. We will guide you. Nothing in return from yourself. The only thing is, we should be. I should feel happy that Gargi Madam should feel happy that at least one from this session become a researcher. That will be a much more happiest moment in my life, that I have
Correct.
given a spark for one person. So be positive, be confident. One small example I want to, madam, just to 30 seconds, madam. One small example
Absolutely.
I want to
It's your
I
you
want to
can
say.
speak.
I want to say.
Yeah.
Madam had told about I have come out with the Braille book, first of its kind in world. That's very important. See, that's different. I spoke about research. I spoke about clinical. I didn't spoke about how come I got idea of going with coming with the Braille and
Exactly.
sign language. One point. I had an opportunity to watch a cricket match at deep south of Tamil Nadu
Hmm.
for visually challenged people. Visually challenged people are playing cricket. Imagine that they don't know where the fielders were set, they don't know where the umpire is standing, they don't know how many spectators were there. So in that, it was like a crucial match. It was like a 2020 final over. They have to score some 20 runs or something, and no, that I still I don't know forget his name. He took the bat and he hit consequent sixes in last over to win the match. I was a bit so I don't know what I don't know what I have done to the society. What I have done, nothing I have done without knowing the ball, without aiming what is coming before. We know what we are facing. They don't know what they are facing. They don't know
Yes.
what they are what is coming in future. We are thinking about future. They can't see the present. We are seeing our
Yes.
present. We know our past. We can see our future. They don't know where they are sitting, where they are standing, who is seeing and who is not seeing, and that that made me a small thing that I should do some contribution for society, some contribution for them. When they can able to do, why not me? I'm not comparing to anybody. So at least everybody should think the feeling that nothing is impossible. There's so many things is happening. So I went and met them. I went to so many schools with visually challenged children. They don't even know that they are spitting blood from the saliva. They can't see.
Yeah.
I can ask my patient that do you the gums will bleed while brushing. They can't do. They
Yeah.
can't see black spots. They can't see white spots. They can't see early diagnosis. So I have trained the staff members. I have sat with this thing. Then I have translated that in the braille version with some of their own people with with saying that saliva with normal taste, saliva with metallic taste. So they can assume that it is some sort of iron containing component, probably blood. So some odd taste I'm getting. So if that person go and tell to the warden or the teacher, they will see some blood is coming over there. So in that way,
Amazing.
I thought I can do something over there and I can do. So you just take it as an inspiration from others. We are. I don't say that we can give small amount of inspiration. Inspiration basically come from inside, not from my mouth or a Gargimaras mouth. Inspiration should come from inside. We just ignite you. We just help you. We just guide you. We are there to help you. We are there to guide you. All the best. Best wishes.
Thank you so much, sir. And it was so nice to know about more about your work, particularly with this book in Braille for and the sign language for the CD that you have made for the visually impaired or visually challenged people. I think this is something which is again a very simple thought, very necessary, and you just did it just out of your one experience of watching a match, and that you took that inspiration and you gave it a shape. Your idea, you just shaped it into practicality. I think that's the very simple thing that we need to understand and do. And thank you so much, sir, for coming to Eclectica in this episode, and it was wonderful having you here. And I think we will keep meeting and we will keep discussing again and again, and give and take your experience and insights, which would be really valuable to all of our viewers. Thank you so much and take care. And yes, sir. So I think it was amazing
Thank you.
talking to you today.
It's my pleasure, man, for giving an opportunity, and thanks for you and your team, madam. Thanks for
Thank you. Thank you, sir. So I think it was a wonderful session from Dr. Aravind sir, and I think all of us got so much enlightened. And as sir said, that no idea is stupid. Write it down and just think that you can do it. So nothing is impossible. That is one thing I have also relearned again from sir. And as you saw that how inspiring work sir has done, writing it in a braille. I mean, nobody has thought about it before. And the thing is that what he did, he just tried to apply his thought into practical reality. He just went out and he did what has to be done. And the thing is that he couldn't do it alone. He had the idea, he had the thought, he collaborated with people who can also help him in this work. And now it's out as a book. So fantastic. And just see his simple thought, a metallic test and a simple test. I mean, yeah, even if there is blood, there is some test change. Amazing. So I think it is so inspiring and motivating, and I think all of you have enjoyed. And those who haven't attended this live, I'm pretty sure that when you watch this, you will be amazed, you will be very enlightened with all the thoughts that Dr. Aravind sir has shared with us. So thank you to all of you who has been constantly with us in this live. Thank you so much for being here. And I will come back with some more interesting people like this to inspire you as well as myself in Eclectica. So till then, good night, take care, and stay safe. Bye bye.